Good morning, everyone. Thank you for joining us today. I'm seeing some familiar faces in the room, which is lovely, and some new faces. So just by way of introduction, my name's Tony D'Ambrosis. I'm the new CEO for CheckUP, having replaced Anne-Marie for about 25 years. So I'm trying hard not to break anything. I've inherited a really lovely organisation with great processes, etc. And I'm fast learning that there's some big shoes to fill. So I'm looking forward to it, but it's a nice little challenge. So this is my first, and let me get this right, Queensland Primary Healthcare Network. So for anyone that's new to this forum, I'm going to be learning along with you. There are some members of the team here that will steer me in the right direction when I'm sure I will go off track and say the wrong things. But anyway, I've been here 6 weeks, so it's just taking me a bit of time to learn everything and get everything under my feet. But I think I'm getting there. So before I begin, I would like to acknowledge traditional owners of the lands upon which we're meeting today and pay my respects to elders past, present and emerging. I've introduced myself. I will talk a little bit about CheckUP and I'll go through the slides as we go along. I'm probably going to jump around. We'll pull it all back together as we get to the end of it. But maybe a good place to start is just introducing myself, where I've come from and where I've been. So initially, I did play basketball professionally for 10 years. When you do meet me, for those online, I'm one of the shorter ones that play, trust me. All right. I'm a physio by trade and played basketball, kept my hand in physio, did not see a future in basketball, and then moved into vocational rehabilitation with a company called CRS Australia, Commonwealth Rehab Service, helping people with injuries and disabilities back into work. Then went out and ran my own business for 15 years, about 8 employees. That was consulting to insurance companies in the same realm, vocational rehab, and I learned a lot about small business in that time and tendering and fighting for work with the big guys. I learned to hate that job by the end of it, and basically retrained as a teacher. I did secondary school. I got through the training and decided it was not for me. The students were fine. For those who have teachers in their family, I apologise. My mum is a teacher. I could not work with them, and maybe that tells you a little bit about my relationship with my mum. But anyway, from there moved to Department of Communities, Disabilities and Childcare, and helped transfer across to the NDIS. I then ended up as Director of Restrictive Practices for a short period, which taught me a lot about human rights and the things I just wasn't aware of, and how we can trample on people's rights was really became obvious to me. Okay. Finally moved into PHN lands, primary healthcare, primary health networks, and I worked with Darling Downs Westmoreland PHN for 6 years, Director of Primary Care there. So that was the GP, primary care, allied health side of things, community. And then I flipped over, moved back to where I live, which is on the Gold Coast, and was the Director of Commissioning there, which was responsible for getting commissioning all the mental health services in the Gold Coast region. So essentially all that was in preparation for coming to become the CEO for CheckUP, as I needed all that background to cover CheckUP. And I've pretty much given you a bit of an idea of what CheckUP does. It's a mixture of workforce, it's a mixture of outreach, but essentially as an organisation looking to improve access to health and health equity, particularly in rural and remote communities. That's not just about getting services out there, it is about what services are there, uplifting scope, identifying gaps, and talking back to the government to let them know here's where the holes are, here's where the here where the challenges are, and what we need to do moving forward. All right, so that's CheckUP, that's me. I'll now go to the team that's going to present today. You can know. So Elena might get you to introduce yourself to start with.
Sure. Hello everyone, my name is Alina and I'm the Workforce Advisor for Health Industry. And a bit of a background about myself, I am a dentist by background. So I did dentistry, then I realized I could be doing something more on the proactive, on the preventive side. So I jumped onto the non-clinical side. I did my master's in health management, specialized in quality and patient safety. And then I did some management consulting. And then I'm here at CheckUP as a workforce advisor. So that's my background.
Thanks, Elena. Carissa.
Good morning, everyone. So I'm Carissa McAllister. I'm the First Nations Industry Workforce Advisor. I'm a proud Wiradjuri woman from the Wellington Valley in New South Wales. And I have a health science and health promotion background. So I'm really passionate about holistic health and creating the space and time to improve health literacy. I've come here basically because my passion comes from, if you change the life of one person, you can change the life of a whole family. And that's my role now, is contributing to closing the gap. Thank you.
Thanks, Carissa. No, you're right. All right, do I just hit the mouse to slide through? Beautiful. All right, so a little bit of an overview. So you can't take the teacher out of me. So here's the highlights. We will have an exam at the end of it, by the way. All right, who we are, your practice, your people, which Alina will take you through. Strong future start here with Carissa, so a little bit of background around that. And then a little bit of a discussion, because that's the whole point of this too, is get some feedback from the groups as well. Okay. Oh, this is going to be the Mentimeter. Can I move that to the end of my speech rather than do it right?
Yeah.
Is that
You
all
can
right?
do
We can
that.
come back to it?
Yeah.
Sure.
Did that work?
Oh, yes, it did work.
There we go. So
Can see it.
we've already covered, as I said, I will be jumping around. I've already got ahead of myself. That's who we are. Oh, Vicky. Lucky I did it. All right. I'm sure you all know Vicky. So perfect. We'll keep, in the interest of time, we'll keep moving. All right. So strategic direction. So you can see our vision there: healthy, sustainable, inclusive communities, and purpose. Create collaborative healthcare and workforce solutions that improve community health and wellbeing and equitable access to care. So I've covered that off to a certain extent. If you were to look at our strategic plan, there's 4 points in there. It's about health access in rural and remote communities. It's about collaboration and getting communities to work together. Okay, hence we're here. There is workforce and uplift scope, and what I've fast learned is I was used to just finding a gap and putting a person in it. It's the lead up work, connecting schools, connecting kids, getting their interests. It's in linking with industry, finding out where the holes are, finding out what the challenges are, getting that back to government and letting them know and informing them. And then it's helping businesses improve, all right, and become sustainable. Because at the end of the day, you can't have access to health without good businesses and access to community helping to design it. So essentially, that's what we're trying to do, and a big passion of mine and something I've learned over time, particularly in my workplace. All right. The final one is probably an internal one. It's about creating a good environment within CheckUP, which I'm working hard to do. It's definitely there. If CheckUP's not working well, the other 3 aren't going to work. So it all makes sense. My point of saying that is it's all interlinked. All right. The outreach we do is going to inform the workforce and the information we send and where we identify problems. Likewise, workforce will help inform outreach and what we're doing there. When I say outreach, that's literally flying services out to towns that have nothing or none of the services that they can access. And if it's and in towns where there is services, is what can we do to help? All right. Have I covered it all or not? Perfect. All right. So today, focusing on that third one, workforce. So we are going to get a little bit siloed, which I do hate because I think we should work across. But the reality is, there it is in all its written performance on the plan: build an appropriately skilled and accessible health and community services workforce for a strong Queensland economy. As you can see, we cover all of Queensland there. It's wide scope. The thing that I look at there that's fantastic, that I guess is unique to CheckUP, is just our reach into across Queensland and our ability to feed back to the government on the whole of Queensland. If I think of PHNs, if I think of Queensland Health can do it, but Queensland Health have a narrow focus. We're probably the only ones that have that oversight of small to medium-sized businesses across the state to be able to inform government on here's what's needed, here's how it works, and here's where it's going. All right. really important. And value your feedback, because then we can tell the government and the departments. And I think yesterday we met with the Department of Trade, Employment and Training, and we also did a roundtable around with the Department of Communities, Disabilities and Child Safety. Encouraging the two of them to talk together, because together they will solve a whole lot more problems than separately. So it'll be interesting. The impetus for that, which I'm sure will be a focus of you guys, was NDIS, the reforms, and the thriving kids. There's some challenges in that, but I also say there's lots of opportunities as well. All right. It means workforce might have to move, change some ideas of where they go, but there's plenty of work out there, that's for sure. All right. Care industry. This is in here to basically just say it's not health. We do health work, but we also do community as well. All right. It's a broad landscape, and to be honest, interlinked. All right. Health and community care, they're crossing over all the time. So it's important to know what it is. It's hospitals, it's medical and allied health services, it's residential care services, it's social assistance services. All right. I think one of the frustrations I see is you get funding for NDIS, you get funding for aged care, and you get funding for health. All right. And if you send someone out to do the health job, you're not allowed to access those other two areas. But the reality is it's the same people doing the job. And one thing we're encouraging government to do is break that down so we can work across it. While people are out there, let them work across the different areas. All right. So it's broad, it covers different areas, and possibly that the government sees it a little bit more narrowly, and we will try and change that. Okay. Why does it matter? It's the biggest employer in Queensland and growing, the biggest rate. Is that right? I think that's right. Yeah. And who does it employ? It's not just medical and allied health. It's care workers, things of aged care, disability and social. It's administrative and management, and it's food services and cleaning. It's broad. It's a large part. Okay. And this one I can't talk to too much, but essentially, Carissa?
So this is the Queensland Unique Workforce Challenges. So when we're looking, it's in my Strong Futures Start Here guide. So it's just looking at what is unique for First Nations workforce challenges, which is actually pretty similar to all of our challenges. Other than we've got the workplaces like in cultural safety and cultural disconnects, but applying to everybody is understanding we've got staff isolation that we're dealing with. We have limited access to education and training, restricted access to remote communities, really unique to Queensland compared to the rest of Australia, and also climate change and how that affects our people and our health and our communities, and the geographic isolation and the logistics of where we go when it's wet and when it's dry and when we can't get in, and how that affects people's health. We've also then got our business performance factors. So our productivity, we've got long and short term challenges. Financially, we have declining margins. Our profitability, we really have to look at that so we can expand our reach and our services and our impact. The reduced investment is what we're facing as well, was what the data shows since the pandemic. We've actually got the highest occupational shortages that we've had. Wages, they're rising. We would say not enough, but they are rising. But also our time for compliance and accreditation is getting greater, which is putting pressure on us. And then we've got our safety and workers' compensation, high insurance needs, which is everything we have to do before we even start to work with people is getting greater and affecting our business performance. So,
Thanks, Carissa. I neglected to say I've been in it 6 weeks, so there's some things I just don't know. And I think that leads us to the point as to here. So I think the solution isn't just finding workforce, and I've got to admit, that's the one thing I've learned since I've come here. I kind of went, let's just get workforce, we can just fill it. The reality is, how do you get that workforce? It's all interconnected, all right? As I said, it's about businesses that are out there, increasing scope. What else can we do? It's what are the systems that are in place? How do we make things more efficient? For my own business, I always found it so difficult to come out of the business, to work on the business. And because when I was out of it, I wasn't earning income. I wasn't bringing money in. And that was always the focus. And at the end of the day, if I'd had some help from these guys, it might have been helpful to then go, here's the systems, here's what I could have put in place to help me improve the efficiencies and therefore make things more enjoyable. Improve profit underlying, all right? And it's part of it, and it's part of the enjoyment of it. That's why we do it, all right? And then it also just leads to well-being of the workforce, which is there. So I'm pretty sure I've covered it off. So at this point, I will drop out because you've reached the end of my knowledge. I'll get the guys with the deep knowledge to go. So Alina, I think you're first. I'll go there. We will open up for questions. We did have the Mentimeter there, and I would like to do it. So I will go backwards. So please feel free to join online. If you've got your phones, pop it up. While we're waiting for it to load, I've neglected the housekeeping, which is a problem. My apologies, I'm hopeless at this one. So this is being recorded and we will be taking photos. So if you don't want to have your photo taken, just please let us know and we'll make sure you're not included in any photos. For those in the room, toilets are out the doors, down the corridor and to your right. Fire exit is literally out those doors and to the right, and I believe we have to congregate at the bus stop outside, but there'll be a few of us to lead the way. Recording, etc. Lunch will be at 11:30 in here, but there is tea and coffee for those that are here that would like it. And that's it. I have done the housekeeping. It's one of my KPIs to improve that skill. My apologies to everyone. Terrible at it. All right. Mentimeter's up. So, I love it. Everyone's already started. Excellent. So, love to know what organisations you're from. Perfect. That's to warm you guys up because there is Mentimeter throughout, so please keep the phones handy. And there will be some questions just pertinent around to the impacts that you're seeing, and it will be helpful for us to see that feedback. So thank you. That's it. Don't have to put up with me for a little while. So I'll hand up. Thanks, Lenny.
Quite a mixed diversity we have over here, especially from people joining online as well. I'll wait when it stops moving. So we have different consulting firms, we have DTED, we have TAFE, so it's all different mix of group we have today. Two more remaining. I think now it's pretty stagnant, so we can move to the other part. So before jumping on to the practicalities of what workforce plan is and what are the realities, I just wanted to share some of the figures which you might already be across, that health and care industry is one of the largest employing industry, but also we are facing one of the most acute workforce challenges. As you can see from the numbers that we might be needing 45,000 more health workers by 2032, including almost more than 6,000 more doctors. And that shortage is more acutely felt by small to medium business owners because they are often competing with that same pool of candidates, often shrinking pool of candidates with little resources, not having an HR or a brand recognition to attract talent from all over the state or even the world. And also they are dealing with increased cost in increased livability cost, but also increased patient demands. So workforce planning is not a nice to have. It should be a necessity for the business to remain viable so that we keep seeing there's more access to care and we are building more healthier queens. So that is some of the figure in a nutshell. So healthier communities requires a viable business behind it. So when we see as healthcare providers, there's always, for example, a GP clinic or allied health professionals, we always see them as healthcare providers, but often they are all business owners as well. So for them, if a business gets closed, for example, a GP clinic gets closed, it will not only impact that GP clinic, but also it will impact the whole of community because the access to care is also disrupted, but also it will impact other businesses as well because now the disease burden is shifted according to the other business. And so it will absorb that impact as well, and patient will have reduced access to care. So when business closes, it's not just impacting one person or business, it's impacting the whole community. So viability enables access and planning. So planning should not be a luxury, but also a necessity because practices running on just goodwill and good people might not be the solid strategy to future-proof your business. But if, for example, a clinic having a very experienced practice manager leaves one day, that business might be losing not just one person, but years of institutional knowledge as well. So it's very important to future-proof our staff and our business in that aspect. So keeping the doors open is not just a business ambition, it's a community one as well because it's impacting the whole community. So now barriers to workforce planning. Now we all know that workforce planning is very important, but why it is not being applied consistently? So what I'm seeing on the ground is first of the factor is time. As business owners, as clinicians, they are doing multiple jobs as a clinician or as a business owner, but also they are sometimes doing the receptionist job, the practice manager job, the HR job. So they are kind of stretched thin. So that gives them less time to see from a third perspective what's happening on a grander scheme of things and how you can proactively see your pipeline, what you need in the future, but actually what you can do right now as well. And the second one is confidence. Workforce planning for some organizations. The second part is confidence. So workforce planning can feel like something that's a big word, it's something what a big organization would need, but actually it's not just an HR compliance strategy, it's a revenue protection strategy as well. So many small to medium health businesses sometimes don't know where to start with, but it can be as simple as having that one conversation with someone. Where is your business at and where you want to be? And what is one thing you can do which you can change? For example, having a careers page on your website so that you can actively having a rapport with all the pool of candidates, even if you are not actively hiring them. So that's the confidence part. And the third is urgency. So not having a workforce plan will not have immediate drastic effects. It's always slow and cumulative. So not just one billing gap or one person leaving will not trigger the acute response. It's always slow and cumulative. Over the time when business absorbs all the pressure, it's only then when they need that, there's more reactive planning instead of more proactive. So these are some of the barriers to successful implementation of workforce planning. Then what good workforce planning unlocks? So as I mentioned, it's not just a HR compliance policy, it's a revenue protection tool for businesses as well. And also it's finding one of the most expensive inefficiencies in a business. So when I say the most expensive inefficiencies, it means that if you are planning your workforce, you are not only putting every person having the best scope of practice, but also there's a great skill mix. So everyone is practicing at the top scope of practice, but also your clinical capacity also increases. So you are seeing more patients and more revenue is also coming. So two things come hand in hand. And also the right skill mix means there are fewer gaps, less burnout, and better outcomes. So that is one of the outcome of a workforce plan. And the second is financial sustainability. When there is lower turnover, means there is reduced recruitment costs. So you're not hiring every third or fourth month, because when you hire, there's always a cost associated to it. So you are saving up money, but also retaining your staff. And the third one is succession culture and retention. So when there is a lesser turnover, it means there's increased retention. And many organizations feel like if we pay more, we might be able to get the best staff or they will be able to stay more. But research says that wages are not just one determinant factor. There are other factors like culture and professional development. So if we provide our staff, our people, that platform where they can upskill and see themselves, upskilling themselves in that organization, we are creating that environment where people would prefer staying and thinking more long term. So these are some of the benefits which can be unlocked if you are into workforce planning or you are just actively thinking what exactly it is. But also, it's not always about the future. Sometimes, whatever staff or people you have, how you are currently utilizing them, because sometimes there is capacity, but that's not activated. So, these are some of the benefits. And now that's one of the case study we have worked with one of the GP practice. All the informations are de-identified. So this is an example where there were like 6 GPs. It was a mixed billing practice and there was diverse patient population with a high chronic disease burden. So what we did was we tried to find out, first we sat with the business, analyze what exactly is the current situation. To find out what the gap is, we need to first identify what is happening currently at the business. And then we adopted a framework, which is very simple, where we listed who all are there in that organization, what are their role, and what could be the potential role. Because some of the times clinicians or staff they're working might not be working at the top scope. And there are things which they might be just filling a gap or just not working according to their qualification. So we created a table where what each and every staff is doing and what they could be doing with that proper qualification. And then we found out where are they losing their capacity. So we found out that 2 of the GPs were planning a retirement. So there was no succession planning. It was very reactive. And the second one was nurse was just limited to basic consults. So there were many other tasks which they could be getting. Revenue was sitting at the table, but they were not aware how to do it. So how you can upskill your staff to do that stuff, or nurses can also do it, but then it's more of GP doing most of the tasks as well. And the third one is their senior receptionist held all the knowledge. So all the knowledge was in her head. The practices and procedures were not documented. For example, if someone leaves the next day, if someone to come over, then there will be entirety of process to make that person learn and go through that process. So there was a key person risk. Every knowledge was just restricted to one person. And the last one was GP was spending time on admin, not on clinical work. So every 15 minutes of the 30 minutes consultation, they were losing their $1,000 of clinical capacity, which could have been saved if that task was done by someone who the staff was already there, but they have not triggered the capacity. So they have not activated the capacity because they have the capacity, but they're not utilizing their staff. So what changed? What exactly happened? The recruitment pipeline opened. So they hired GP within the first 3 months. So actively planning that they have 2 GPs, there will be a gap. So we need to start hiring now, or at least start the process. And the second one is they not increase the scope of practice, but actually updated the position description to reflect the scope of practice, what nurses can do. And third one is Certificate 3 trainee via Career Start Subsidy. So that's a Queen subsidized training program. So they upskill their trainees so that they can shadow the reception who was doing everything, so that if there is any emergency or crisis when someone leaves, someone is already seeing the work so they can take it from where they leave. And the last one is GP clinical time reduced. GP clinical time returned to patients. So they're not just doing admin work, they're actually seeing more complex patients, which was not the case initially. So this is a case study. And what is the revenue logic is, with proper role design and scope activation, we are increasing the capacity also, and we are also regaining that capacity as well with increased revenue and more better access to care. That's the next case study with allied health practice. So what really struck me at this point in this case study was, there was one owner who's a psychologist, clinician, but also who's doing multiple people's job. That person was also the clinician, but also the business owner, was also recruiting, writing questionnaires for someone for the future staff. So they were doing multiple jobs, but also they have a provisional psychologist who has completed their 5-year training but have not got the APRA registration. So they are still supervised by the psychologist. So they were handling full caseload, but also doing the Medicare claiming, rebate processing. So provisional psychologists also did not have a set structure when they are supervised, what are the times, and it's not a documented procedure. And also there was no career pathway or employee value proposition. So what that means was, it was a new practice, but for any future provisional psychologist or even a patient, or even their aspiring candidates who really wanted to work in that position, they did not know that practice had some of the unique things which other practices were not giving. For example, they were giving increased extra leave for CPD points, flexibility. So what we did was, we found out what exactly they were providing, and then we framed it into a one sentence. What exactly is unique in your business, which some other person will not have that? So that is their unique value proposition, their USP. And then the owner was spending again on admin and doing multiple tasks which someone else at a lower wages could have been doing, because if the psychologist is doing 7 hours, it means if they are privately billing, they're losing $300 every hour times the 8. So this is the amount of money they were losing. So what changed? We scoped the admin role and we connected them to a wage subsidy where they could hire someone, get $15,000. That would offset the hiring cost, but also they would get a person who will be trained, and they will be continuity of care in maintained as well in the business side as well, and also the patient side. And then we also connected to different other programs, for example, free fee TAFE, Certificate 3 in health admin. And then the supervision structure was also formalized. So not only when the supervision was completed, the potential supervision also had a set structure and system where they feel supported. So there's a continuous pipeline. You're growing your own pipeline by having the system and structure in place. And then the career pathway and employee value proposition was documented. Wage subsidies were connected, and the admin person was hired. So these were some of the changes in a nutshell, what happened just by analyzing where they are at in the business journey, where they want to be. Again, the revenue logic is the admin role was designed. There were some of the things which the psychologists were doing, which was expensive, is now being done by an admin person because they had the capacity, but they were not utilizing that. And also the pipeline was built. Why is that business unique in terms of providing healthcare, but also in providing support to their staff as well? So these are some of the case studies. And I will stop talking now. I just wanted you guys to at least give at least 1 or 2 answers to this question. What is the biggest workforce priority for your organization at this point? It can be 1 answer, 2 answer. Just wanted to get your insights. What exactly is your top pain point at this point? Or everything is if working perfectly fine. Growth, upskilling staff. Funding, workload. Retention, upskilling.
I think the purpose of this exercise was we're well aware of the challenges now because we've been doing it for some time, and there's capacity and there's knowledge, there's intelligence, there's more people in this space. But what we're finding is we may know the challenges, but the priority for that region, town, or clinic may be different, and that's what we have to acknowledge. So I guess we're just inquiring, what's the priority that you're currently seeing at the moment, and just see what we come up with from the diversity of our room and who's attending today, which was pretty amazing.
We have quite a diverse group. We have.
Yeah. So diversifying revenue, getting staff trained, upskilling staff, retention, workload, it just all moved around on me, sustainability, consumer engagement, the ARCHO sector, funding, getting staff trained, succession planning, process efficiencies. So it's a couple there I haven't heard specifically worded that way. But I think that's a part of what our CheckUp's industry workforce advisors do, finding where you're at this moment and how we can step you forward. And although we know the challenges and we know what lots of tools and we don't know everything, but what we don't know we'll find, where do we start for you? So that's sort of the difference when you actually get that advisor service.
I'll hand over to you, Carissa.
I've got a question. So just remind me about Mentimeter. If the word's in bold, it means it was entered a whole lot more than anything else. Is that right? Yeah, that's correct, isn't it? Yeah. Okay. Yeah. Yeah. So we can look at that and go retention, workload, and growth are the three biggest ones.
Three main ones.
Okay.
And we've got some new trends from what we're seeing when we're working with clients just around that retention, acknowledging that. Staff are burnout, and I'm coming across them through different organisations. Nothing's really changing. They're just moving for the break. You know, change is as good as a holiday, but nothing's really being fixed. And confidentially, we talk to them all and we still help. The other one I'm starting to see more recently is people will move for professional development. Okay, so, and giving that to someone working in your business is hard because you take them out of their income capacity, or if you've got patients or clients that can't be seen. But you can't implement those strategies and use that care if you're not doing that PD. And people are seeking opportunities now. Okay, so yes, we'll have salaries going more to government. Cost of living is getting hard, but we will choose value and we will choose development and opportunity. So, and our workloads are growing and we're just fitting more and more in because we care. That's our industry, we care. And growth is getting harder because of that profitability. So something that is declining and getting harder for us to do. And one of our most expensive things we're paying for is the time of our people now. So yeah, thank you.
Thank you, Carissa.
Feel free to keep adding on to that.
Not every 26 have to respond.
And welcome to everybody online. Please participate. We've got Deb facilitating. So if you've got any questions or anything you want to add, pop it into the chat. And we've got Deb here watching that to keep you included. And thank you for joining us. How do I press through?
So just this one. Okay. There you go. Over to you, Carissa.
Thank you. Thank you, Elena. So I just wanted to take a step back after listening to Elena, and so amazing with what she does, and just talk a little bit about the Industry Workforce Advisor program that we have here within CheckUp, which is proudly supported and funded by the Queensland Government. But we have three of us. So Elena is our Health Workforce Advisor, and we have Stuart, who's in the room with us today. He's our Community Services Workforce Advisor. So off the top of my head, aged care, child care, disability support work, domestic and family violence. A couple more things there probably, sorry, off the top of my head. So, and I'm the First Nations Industry Workforce Advisor for Health and Social Assistance. So I have the intelligence and the networks and the support of both Stuart and Alina for Health and Community Services. And when I came into this role, we were 1.5 years into our program. And I was like, how do I do this, being part of a health workforce and really wanting to make that impact on the ground? I was like, well, we have health and we have community services. My role is to actually make it meaningful, culturally safe and responsive for our Aboriginal and Torres Strait Islander people, employees, employers, workforces, businesses, organisations, all of the above. So how do I do it differently? Knowing that we also have, provided by the Queensland Government, 11 workforce advisors around Queensland for the other industries as well. So how do I do this differently? And how do I use CheckUP and help CheckUp do that? So going back to our Strong Futures start here, what I really like to do is put the people, which you can see on the screen there, happy people. How do we use that and how do we help that? Okay, that's where our futures change and that's how we can have strong futures. So what I ended up doing was creating a guide, and that's called the Strong Futures Start Here guide. So you can download it here. This is what it looks like. It's down the back of the room for you as well. But basically, this is a workforce planning guide for the Aboriginal and Torres Strait Islander health and community services organisations. So there was a lot of resources around, and we've got a lot of people, but nobody was really looking at it from an Aboriginal and Torres Strait Islander perspective. So how do we make that meaningful and culturally safe? So this guide was developed, and I'm here to talk to you today about why we made the guide and how we made it. And we've had some really great success around how that's worked. And we've even had a Central Queensland allied health business say, who have great HR and a workforce lead, absolutely amazing expertise. But they said, I saw your guide, I know exactly what I need to do, and I'm just going to follow the steps. And then I'll come out and help if they need some more independence or advisory service in between. But it just resonates when people read it and soak it in. What have I got now? And it was also around doing things differently. So it's the behaviour change, the attitudes. How do we influence and get people to step outside what they're already doing and find the time and find the money and find the passion? So I found this on the plane on the flight down in an article by James Toomey, who's the CEO of Social Ventures Australia. We need to have some different approaches because tried and tested is how we got here. And that's not always going to get us out of it. Okay, so that meant a lot to me, and that's something that I try and get the attention to see how we can actually move forward. So I just want to start with what I heard when I started to going out offering this service. So it's like, I don't have the time. There, people providing our care, whether it be clinician or our support workers, they don't have the time for it. They're just busy trying to get through their day and see the people they need to see and get through their wait lists. I don't have the money. They're thinking thousands of dollars, you know, and they're trying to keep their doors open. Okay, how do they invest in those skills or those programs or even another body to help them do it? The other thing I got was, what can I give my board to get their attention? You know, it's like, there's nothing really relevant for me to say, give them this. It's nice and sweet. It shows how it's done and it will actually get attention and show impact. I heard that's the job of my peak body or government or somebody else. And they just keep moving within their day, you know, understandably. I don't know where to start. Overwhelming, information overload. You go down the rabbit hole online and then you got to get back to your work. And interestingly, what is workforce? Most of us here know what that is, but generally it's a government or a peak body term. Our businesses on the ground, our health providers don't really resonate when they hear that. They're just trying to do their role. And Alina and I sat in Far North Queensland in a PR and a marketing workshop with some local businesses up there where there was 10 of us. So Alina and I were in health. We had a First Nations business there. We had 2 other health businesses there and 5 other diverse local businesses. So we were half of the room. 20% of us had an Aboriginal background. So we make up a lot. When we say we're the largest employer, that's actually right. We are a big industry, but we still need more. But the other businesses sat around and went, wow, you know a lot. Oh my God, we didn't even know about you. But the other ones, they weren't health. And I was like, well, there's more of us here. This service is available. They said the problem is the workforce isn't meaning anything to us on the ground while we're trying to keep our doors open and we're trying to see our patients. Okay, so this is why it was around creating awareness, increasing knowledge, and getting people to start. So that's where we went to make the guide. And this is a quote that is in the guide, trying to explain it. And I've seen people read this and they go, oh, I get it, what workforce planning is now. So it's not about predicting exactly what will happen in the future. It's about starting now, knowing your next step forward, and being proactive and responsive to change, challenge, and opportunities. We can't meet that true need of what's needed on the ground in our communities in 3 or 5 years if we aren't doing it now. We can't worry about it in 3. The smaller steps, at least you're heading in the right direction. And a lot of these workforce plans at the start aren't very mature, but I'm 1.5 years in and doing second workforce plans now, and they're on track, and they're even growing bigger than when I started first here at CheckUP, which is amazing. So I just want to talk a little bit about what went into making the guide. So we had we looked at the National Aboriginal and Torres Strait Islander Health Workforce Plan, the First Nations First Strategy, the Queensland Skills Strategy, at the time that was the relevant one, the Quake Workforce Strategy, the Workforce Connect tools from Jobs Queensland, which we have a lot of templates and a lot of different industry toolkits that you can work off. We had 3 years of the workforce from First Nations Health and Health. And then we also then partnered with First Nations Media Company to bring all of that together on how do we get people started. Not that it can get way more bigger and complicated than what this is. How do we get people started and how do we make it culturally safe and meaningful? So that was closing the gap. Priority form number 1, we partnered with Aboriginal and Torres Strait Islander expertise. And it was a journey and there was a lot of learnings in it, but it's come out quite brilliantly. The feedback that I have gotten since we made this was the numerous local councils have contacted me and saying they're starting to implement it now with what they're doing. The media company CEO really worked on it and went, Carissa, I'm going to look at all my people and the way we do things so much differently now. So she was working on it from her perspective and how she can help her workforce. And we've got people thinking differently and actually thinking more strategically about it now rather than just trying to get through the day. Okay. Now we do have a resource for those executive or boards to actually consider to start to implement because we've made it look easier. Not that it's easy, but it's accessible now on how to start. All right, where am I up to? Sorry. And within that, we build economic strengths. So when we're helping our Aboriginal and Torres Strait Islander businesses, we're building economic strengths. You know, on that Queensland map that you saw at the start, we're doing that all over Queensland. So interestingly here, Supply Nation reported that 5.83 billion was invested in Indigenous business and it's growing. Interestingly, 4.3 billion of that actually came from corporate, not government. So I found that very interesting. Indigenous women secured 1.52 billion. Some stats on that when I looked at who is our workforce in Queensland. 78% of our workforce, so our employees, are female in health and social assistance for Aboriginal and Torres Strait Islander people. 67% of the business owners are female. And the average age of business owners for Aboriginal and Torres Strait Islander people is 34, whereas non-Aboriginal and Torres Strait Islander people is 47. Okay, so really knowing who you're trying to help and how you can help them is amazing. And you take that down to a local level and it'll change again. But just seeing that was really interesting. So beyond economics, we're delivering lasting and social value. So I'll start to go through the framework. So when we have a model of success for a First Nations workforce, we start to look at, well, what are we aiming for? Now, keeping in mind, I've tried to make this general as I can so someone could look at it and just change a few words to make it specific to their sector, industry, or business. So we've got here, building a strong and sustainable Aboriginal and Torres Strait Islander workforce means providing culturally responsive, holistic health and community services that meet community needs. That's what we're trying to do. That's what we're trying to achieve. And when you take that back and you go, how do we achieve that? We start to get a little bit clearer rather than being in the mess and trying to divert time. When I have worked with some of my clients, I sat around in a round table with an ARCHO, with the Peak Body Workforce Development Manager. So we're talking about what's your aim? How do we personalise this for you? And they all wanted to be an employer of choice. But I've seen the employer of choice and I've heard that. I was like, but what does that mean for you? And they're like, oh, okay. And then the CEO went, we're going to be the best Black employer of choice. And everyone smiled and was like, yes, that's what we need to be. And then when I was looking at what they could do with what they had, they were just sort of thinking isolated. So I was like, well, how about your local community? Because they had a good relationship and a lot of support from the community centre. But then it was like, well, what about if we head out of town and into the main areas? What about your region? What if you were the best Black employer of choice for your region? And they went, yes, that's what we want and that's what we need to do. So actually getting that dream and that aspiration, making it clear and getting people excited. Another example I had there when I've done this as well is Aboriginal Community Controlled Domestic and Family Violence Service. So they looked at that. They're going to change that because it needs to be a little bit more specific for them. But they identified that they wanted to be the specialist service for that sector. So how do they do culturally holistic and therapeutic domestic and family violence, and really focusing on the specialist part of that? Okay, so really finding out where they need to go and getting them to own it and get excited and get them on the same journey. And then this is what we can look at and how we can develop our actions. So this, when I've showed people how we do it, I said, if you look at your workforce data, planning, development, and governance, they're like, yeah. If you look at your attraction, recruitment, and retention, yeah, they got that. And then education, training, and employment. If you have actions sitting along those that you can do in the next 12 months, that's how you step this forward and that's how you get a successful workforce. And I had so many aha moments. They went, oh, really? It's not that hard. I can do that. It can be big or it can be small. So this is just the model that we've sort of made. And again, changing it for certain scenarios, but this is something that people can work with. And then as I did some work, meeting some boards where they were making their strat plan, or their strat plan had just been released and it hadn't gone into business, I looked at those examples on the themes or the focus areas that they were focusing on to then try and help others sort of look. And this is for the ones that are like, I don't have the time or I don't have the investment to actually make great change right now. These things don't cost money. Thinking differently on how we empower leadership from our current leaders, but then how do we bring up our leaders underneath that? How do we be courageous in your communication? Not saying what you think people want to hear or the public wants to hear, but how do you speak and get your unique value of who you are and what you have to offer to everybody, being courageous around and owning that. Okay, why should people work for you and not the place next door? Okay, and really putting that out there. You don't need everyone to work for you. You don't need everyone to use your service, but we want the right people. Okay, and then the pathways. Strong pathways, making them clear, making them accessible, whether that be the training pathways. There's a lot on offer now, and that gets confusing even for me. And I've got some intel in my team that I go back to when I really want to know how we navigate that. But where's the pathway to employment into that organisation? Or where's the pathway for me to step up in my organisation and be a leader? Or maybe I don't want to step up, maybe I want to move into another area. How do we make that clear and accessible and so people can see and be confident? So they're the things that, yes, they can have investment and time, but just how we can actually think differently without using tons of investment and tons of time. And then within that, I found 12 steps to get people started. 12, why did I do 12? I'm not sure. I was just thinking if you had a small team, if you did one thing a month, you're heading in the right direction. If you had a big team and you were ready to take this on, you could probably do these in a week, right? So that's where the 12 came from. But this was about trying to make it real. So the first step is nominate your workforce champions. So this really came from when I worked in the cancer care space for Quake, and really knowing who's the champion, right? So for cancer in a clinic, and really leaning on them and getting them free to actually then try and improve cancer care. So who's your workforce champions? Because you can't do it alone. It's everybody's responsibility. So who is it? It needs to be within your exec, in your board. It needs to be within operational or in business development or in HR and in quality. We've got to embed it across. But who's going to really champion it and bring you home? You need a decision maker. You need a project manager who's got the time, who's going to run it. And then you need to embed it across your workplace. Who are those people? And getting a team together, because on your own it's hard trying to make that impact. Second step is getting to know your workforce. So who are your people? What do they want? What do they value? What pathway are they looking for? Alina talked a lot about profitability and getting people to work to the top of the scope. That's a big part of it. But what if that person doesn't want to work to the top of their scope? They would like to do more community settings or groups. Just understanding that. Or they do want professional development, but which one? And if it's not this one, maybe there's another one that we can offer them. Do they want leadership? Or do they just need to go in to a different subject matter or a different area and have some wins there? So we've also got access to a strengths-based participation tool that's provided by the government as well. So if you've got people at risk, or you really need risk of leaving, or you need to get to know them, there's one of the tools that we can help you get access to, so you can, in a strengths-based way, get to know your people and get to have those conversations. The third one, identify education and training opportunities. There's so many out there now. All right, so we can help you navigate that, and that can get a bit much for me, but with my team, we can help you identify where the opportunities are, where the pathways are, what that can mean for you, and how you could actually get support with funding for that as well. A big one is the employee value proposition statement. So taking your branding back to your people. Why should people work for you? Not down the road. Who are your people you've already got? Why do they stay with you? And why should someone choose to come and work for you? I've delivered an in-house facilitation for that for a team who lost half their workforce and probably weren't viable, but they really needed to stay because they were in remote health, and they were really a bit down and a bit sad, and they didn't know what was going to happen. But the bonus of that was I walked in and I didn't know anyone, and I knew they had the strength, and I knew they knew what they needed to do. They just needed to come together. But all the personal stuff, who left or what was happening, I was independent. So I came in and we built it up, and we started to realize why they're there, what they have in common, and how they can really communicate and reach out and bring someone in and make them a part of their team. The next one is launch your community value proposition. So what do you offer your community? Specifically your allied health business, or your GP practice, or your support work. So that is really important. Not generally I do physiotherapy or I do disability support. What exactly do you offer your community, and what do you do better than anyone else? Okay, and how are you communicating that across? And especially within those two, someone who's considering about working for you, they've researched you as much as they can for the past 2 or 3 years. So what have you got within how you're communicating to the outside world around why people should work for you or why people should be part of your community? HR strategies and systems. A big barrier, but we can help you access what upgrade or access or see the alternatives or see what's working for the other places that we're using and how much they might cost and how you can streamline that, because it's getting harder, right, with compliance and accreditation. But if that's clunky, if you start off clunky when you're trying to hire someone when they're inducted or a year down the track, then it just makes everybody's job harder. So how do we make that easier? How do we get up with technology to save our time? But then how are you using your employee value proposition across the whole life cycle of your HR? The other one is the strengths and values-based participation tool. So that's getting to know your workforce again. So how do you get people to participate? So I've got one tool that the government has provided access to for now, at this time, and that may change. But I've also got people developing their own, okay? Because if they can do that internally, it means more and it's not so generic. But how do we get people involved more in our work and how we help communities? The governance and succession planning, people know it's there, but the compliance and what we have to do around governance is getting harder and taking up time. But how do we make that strong, and how do we take that back to why we do what we do, and how do we look after our people? And making that easy. If that's hard, we're burning people out, we're stressing people out, and our relationships suffer. And then succession planning. So not when you think someone's going to retire, someone's always going to leave. We're all replaceable and we can all get hit by a bus tomorrow. But where's that pipeline sitting there ready and being uplifted to get ready for that process? And I think that's a big unknown, the succession planning. They know the word, but they're not too sure how to do it. So that's where we help as well. Data-informed decision-making. This is something where I've got people looking within their practice and they're just looking at what they have. They're not looking into their community or their future need. And if we look at what that is and we can help you access that, how do you know what you've got to look like to service your community in 3 years? Well, now, but in 3 years, what are you working towards? So where is that data? And that might be going out through partnerships locally as well. And then, getting into us, and there's many other solutions as well, but knowing what that is and helping that inform how you plan for your workforce outside of your business or your organization. Spending time on your partnerships. Not every partnership. Which one as a workforce do you need to actually invest your time and your money and your people into? Who's going to help you? You're also your workforce champions. So a bit of a review and a skill matrix. Where are we going to actually invest in our partnerships? Who's going to help us? So that goes into sort of the regional workforce planning and stepping outside your organization. And then the business and workforce strategy alignment goes back to, it's not a workforce problem. It's not a HR person problem. It's not a workforce lead problem. It's everybody's responsibility. So how are we putting that into our continuous quality improvement, our business as usual? What metrics are we using? What's our human experience? And aligning those constantly. Your workforce plan is a living document. It changes as your business plan does. So over here I've got one of the testimonials that I got from one of my clients. She was so grateful and excited. She was an allied health professional in Central Queensland. She was so excited to work with me because I got to know her and she knew I could see her and I could see her value. And she was looking outside of not just providing that appointments that she could, but how she was wasting her time on the things that she could have had other staff helping her do, which means she could have helped more people. Then she could also mentor 2 or 3 or 5 other professionals under her, and then look at those grants to then actually get the community work done. But whenever she was sorting out the photocopier, booking the appointments, finding out why a client didn't turn up, or rearranging an appointment, all of those things won't happen. So she was really, really excited, and she had a business coach, she had financial help, but she's like, I can show them that this is where I need to go now. So she got confidence within that process on how she can report that back and get that higher level business support. So what's next for the First Nations Industry Workforce Advisor for 2026? We're looking at places for yarns, okay? Creating awareness, increasing knowledge, building confidence, finding that empowerment. So how we can exchange stories and how we can learn and create. So that's what I will be planning coming up to the end of December. So if you've got any ideas or any scenarios, any situations, any way we can partner, reach out. I'm here. I think we're stronger together than we are alone. And then we're also taking why this guide was made and how it was made to the Developing Northern Australia Conference in August in Alice Springs, which we're really, really proud and excited about. So that's something that we'll be taking up there. So yeah. Oh, I don't know what I did. Okay. All right. Any questions? That's me. Yes.
I'd love to know where you got the data about the people who are running the businesses, the women the 52% or whatever.
It was the Supply Nation report.
Which one?
Supply Nation?
I know.
Yeah. Yeah. So I can get it to you if you like. Yeah. Anything else? All right. Thank you, everybody.
I think we're running over time, aren't we? No? Up to 12? Oh, okay. All right. Then why was it to 11:10? 12. Right. There we go. Apologies. All right, so next bit. So this is a chance now to collaborate, come together and chat. So the first thing I'll do is ask if there's any questions around. Did it resonate? Is that enough information to understand, to take back? Or is there more that you need to know? As you can tell, both passionate, both knowledgeable. I can assure you that goes across the team. They get great joy out of improving and helping you improve your business. And if it doesn't apply to yourselves, if you know of other businesses that you're linked with that would be beneficial to or you're working with, please spread the word and let us know and link us in. So that's that bit. Any questions from anyone, and including online? Anything? Any comments?
I guess I've got a comment.
Sure.
I was really inspired, and I guess I wasn't aware. I've worked with CheckUP for a while, but I guess I wasn't aware of just how granular. Sorry, I wasn't just aware of just how granular and impactful at that individual level the team was when they were going out, and I really enjoyed the case studies, and I could see the application for a lot of different businesses. So thank you for bringing it to life.
Brilliant. Thank you. Anyone else? Nothing online? All right. I noticed, I'll start a comment. Perfect. Brilliant. My apologies.
Look, thanks for that. Really informative. I was interested to know what the overall outlook is, I guess, the feedback from regional-based healthcare providers, small, large, in light of all the changes taking place in, what is quite a volatile sector at the moment. How are they coping, and, are they, excited about the future? Do they still see future, or is there a need for them to change dramatically? I'd be curious to know if there's any feedback about that.
All right, I'll go out on a limb and answer it in my six. Oh, go. Yeah, go, Chris. Yeah. No? No, I think the answer to that from the round table yesterday that I attended, I think it's the unknown, and there's always fear associated around unknown. Okay, and in particular, NDIS, fuel costs, the other thing is our costs. Is the income going to keep up with the increasing costs as well? So I guess that's stuff that businesses always have. Are they positive? I would say they're just waiting to see what's going to come out of those changes and those reforms and where it's going. I think health in itself is okay. There'll always be shortages, but that community sector, I think, is really what does it mean for us and where do we go? What I would say is there's opportunities there as well. All right. So while some work might be drying up in one area, there is tons of work in health and communities across the different sectors, and that's that siloed bit. Don't look at it siloed. And I think that's what I would encourage any business out there in health or community is look across the silos and see where you can go, because there's plenty of demand out there. Trust me, there's tons of jobs out there. It's just where they are and what they're doing. So I think it'll be a big period of change, huge period of change. I think the bottom line is there will be less money out there. There will be less funding. That's the whole idea of those reforms in the NDIS, is controlling those costs. But as you've seen today, great chance to sit down with the team and work through what are the opportunities out of this, where could it go? Okay, so probably a little bit early to really get a feel of where. I think it's just about, well, what's happening. That's the feel, and let us know. And I think that goes to state government as well. No one really has any information coming down from the federal government at this stage around what it's going to look like moving forward. Hopefully that's answered it to a certain extent. I don't know if anyone else wants to answer it. What I was just going to say one last thing too. If we can't help, our team is really knowledgeable about what other supports are out there as well. And my philosophy is it's not siloed. It's not if we can't do it, no one can do it. It's about what else is out there. All right. So if we're not the right person, we will certainly undertake to link you with the right people as well. Okay.
I think also just around the excitement comment, I think it's hard. I think we're excited about helping people, but I don't think people are excited about how they can expand or where the money's going to come from or what's going to happen. But if you've worked with Alina and I, we can't help get excited because we'll see your unique value and we'll get excited together, and there is support there, and that's how we get people to grow. So I think that's a part that's unique. Yeah, that's who Alina and I are, and that's what we want. So there is help for that as well.
I just wanted to add one more point what Tony said, the fear of unknown, but also at one of the part of this program is we help you sit diversifying your revenue streams. So there's always not one funding bucket, NDIS, Medicare, DVA, work cover. So we help in sit and actually connect you with different pools of buckets that you can take advantage of.
I'd wholeheartedly agree. And I suspect aged care is going to get a boost possibly as well, would be the other area to think about. So, all right. Any other comments? Did that get anyone's creative juices flowing? And all the online people are checked out? No, nothing on there? Okay, we might have to challenge an online person. Just pull a name out of a hat. That's what I used to use. I look at my comment. I was just going to, the intriguing thing was retention, workload, and growth. And interestingly, the growth and the workload aren't going to help your retention to a certain extent, is it? They're working against each other. So I was intrigued, and I think we'll work on that, and I think maybe even create some information around that to help out. But you know, the growth and retention is a good thing. It's about making a place that people want to stay. Is what I would say to you, and all the things you can do for that. I've learned that over my business career. If people will give up income and opportunities if it's a really good situation for their life and their lifestyles, etc. So think broadly. All right, let me flow through. So I think we have a Mentimeter.
I think we're going to skip that because we're running out of time.
We are running out of time. Yeah, we'll have to.
So this was just wrapping it up in something that means a lot to me, because Alina and I are out there offering support all the time, and we know people are busy and they don't have time, and there's always another priority, especially when it comes to health and care. But the power is in actually accepting the support. That's where we can start to create change. So we're here, we're available, but also, can you offer support to us? And is it up to us to accept that? And how do we partner and get out of our own brand sometimes, or, and actually have our shared purpose? So, yep. And then I think it's just one more. So this is our Industry Workforce Advisor Program, how you can access Stuart for Community Services, Alina for Health, me for First Nations Health and Social Assistance. In saying that, Health and Community Services, there's no start, there's no end. I'm based in Cairns. Stuart and Alina are down here, but we travel the state. So reach out to any of us. And then once again, proudly supported and funded by the Queensland Government. And the providers winning the workforce challenge aren't finding better candidates, they're building better workplaces. So if that's something we can leave you with, and know that we are here to help in an individual way, or maybe in a way that there isn't a solution yet, we're here, and reach out. And thank you.
Thank you. Any last questions, comments? Going, gone? All right.